Good morning, everyone. So I'm Professor Alexandre Belot in Lyon, France. I'm very pleased to be there.
Hello, I'm Professor Sophie Georges Lavial. I am a French adult internist in Paris, and we are very glad to be a duo of one adult and one pediatrician to present you the French DADA2 cohort today.
So if you look at the patients diagnosed in childhood, only 6 patients were diagnosed by pediatrician actually in the cohort. And the main presentation was systemic polyarthritis nodosa. And one patient displayed features of systemic GIA, and another one presented initially with immunodeficiency and autoimmunity. And this patient was later treated by bone marrow transplantation and finally died, unfortunately. If you look at the age of diagnosis and the age of the first symptoms in children, so the mean for the first symptoms is 4 years old, and the diagnosis is made 5 years later. So there is a quite long delay in the childhood population of 5 years, and we hope that it will reduce over time.
Concerning adult patients, 13 were diagnosed since 2015. Their main presentation was vasculitis, especially cutaneous, with ulcer, livedo, chronic ulcer. Some of them had neuropan. One of them was diagnosed as seronegative arthritis, and a few of them had psychiatric symptoms. You see a wide range of age at diagnosis, going until 65 years old, whereas symptoms always began in childhood. The mean delay was almost 20 years, with the max of 25 years old for the eldest woman. And you can see that, of course, as the disease was discovered in 2014, the diagnoses were only made after, but we have a lot of work to explain and make known this disease to adult colleagues.
So here is the overall data on the whole cohort. So again, the mean delay is very impressive, and there is a lot of work to do to highlight this diagnosis in the adult specialists, especially. If you look at the genetic data, we didn't mention before, but 12 out of 18 were carrying a HET compound variant in DADA2, and we have no patients with the Georgian variant that has been described before.
We recently submitted a literature review, included our French adult patients, comparing 2033 DADA patients and their main features. It shows that the vascular presentation is more frequent among adults, whereas among children, there are more hematological or immunological presentation. We also published a paper on the cutaneous finding in the French cohort, but also in literature review. It shows that there is livedo in all cases, mostly racemosa, mostly large pattern. When a skin biopsy is performed in livedo, it's either normal or non-specific. It can show small vessel vasculitis or cutaneous pan. If a biopsy is performed on ulcers or nodules, it can show also small vessel vasculitis or CPAN in all cases. Here is one example of a patient diagnosed at the age of 30 years old. He was homozygous. He presented atrophic scars with atrophy blanche, and he had 3 different skin biopsies on leg nodules that I can show on the next slide. Here you can see lesions of CPAN, but with atypical predominant thrombotic features. Overall, CPAN on skin biopsy is suggestive of DADA2, but its absence or thrombotic feature does not exclude the diagnosis.
In this slide, you can see the whole picture of initial diagnosis of patients of the DADA2 French cohort. and it is dominated by polyarthritis nodosa, but several other diagnoses were initially considered in this patient. Then here it is the therapeutical odyssey of the patients, and most of them get steroids during the treatment, but several other immunosuppressive drugs were used. And if you compare the children to adults, it's interesting to see that children were diagnosed quite early, and they almost were treated by anti-TNF quite shortly, while compared to adults, most of them get several lines of therapies, and some of them 6 and more before having TNF blockers. And this is very, very important to mention that in adults, especially, it's we need to advertise and make this diagnosis visible.
Concerning evolution on the cohort, Alexandre just told you about the children, and all of them received anti-TNF therapy. One was bone marrow transplanted. One unfortunately died. And concerning adults, only half of them received anti-TNF therapy, mostly because some clinicians think that some patients with only Livedo should not receive anti-TNF. And one received bone marrow transplantation. One unfortunately died also at the age of 19 years old. And we don't have any cases of AA amyloidosis in our French cohort.
So finally, we also run a phone survey during these pandemics and ask whether or not they have experienced COVID-19. And only one patient had a COVID-19. This is a 16-year-old girl who presented only mild symptoms. There were no hospitalization and no flare of the DADA2. So thank you very much for your attention, and thanks to all French DADA2 doctors, especially Dr. Fayan, who made a lot of work. And a special thanks from the Baudiès family, who were there a couple of years ago in Washington, and they are a special bye-bye to Chip.
And also, we would like to invite you to participate to the virtual Dear Winter School, which is going to take place in March in the Swiss Alps and also virtually. And we are co-organizing with Alexandre this winter school with the main topics as vasculitis, especially DADA2. And we hope that the DADA2 Foundation at CHIP can also participate virtually to this winter school. And thank you for your attention.